A very good morning to you. I'm Howard Feldman, and this is the Sunday Synthesis COVID podcast. We're broadcasting live this morning from Sandringham Gardens, from Golden Acres, and we hope to answer as many of your questions as you have sent in. Joining me, 20th of February 2022, of course, is Dr. Anton Meyberg. Thank you for being here. How are you?
Good morning, Howard, and good morning, everybody. So today we're at Golden Acres, Sandringham Gardens. What a special place, and how blessed we are as a community to have this place for our elderly. There are currently 423 million cases worldwide, with 5.9 million deaths and 348 million cases resolved. The United States has 80 million cases with 959,000 deaths. India, 42 million cases with 511,000 deaths. And the United Kingdom, 18.5 million cases with 160,000 deaths. South Africa has 3,657,091 cases with 98,617 deaths and 2,267 new cases in the last 24 hours, a 7.5 test positivity rate. There are currently 1,571 cases in hospital in Gauteng, with 107 in ICU and only 41 ventilated. And an interesting tidbit is that in the past 18 months, over the COVID period, when many of the first world countries experienced high death rates in the elderly care homes, especially during the first wave of between 40 to 70%, Sandringham Gardens, Chevra Kadisha have experienced a decline of a 30% mortality. In other words, 30% less deaths due to quick action taken by the powers that be in protecting this aged facility. Unheard of. A huge effort from the doctors, nurses, care workers, auxiliary workers, physiotherapists, psychosocial workers, and the whole support team, as well as the fact that Sandringham Gardens have dispensed 75% less antibiotics, a massive shkach and mazel tov to an unheard of success, thank God.
So that's interesting, because that means that it's not only COVID-19 that has reduced, that was lower at this facility, but in fact, other illnesses as well.
Dramatically lower. There's no doubt about it.
Fascinating.
Due to the fact of lockdown, due to the fact of people wearing masks, due to the fact of people not interacting, there's been a massive decrease in the normal viruses and bacteria that people have been exposed to.
Very, very interesting. So that is something very positive. Tell us what you're seeing in the hospitals at the moment.
So it's actually unbelievable. In my hospital currently, there's one patient with COVID.
Wow.
That patient's in a general ward. They're not in ICU, they're not on a ventilator, and they're actually only there because they've got a secondary infection, not because of the COVID, and they were found by to have had COVID.
In terms of what you have seen with this wave, with the Omicron wave, is it everybody coming into hospital in equal numbers, vaccinated, unvaccinated? What are you seeing?
So I'd say the majority of people that are coming in with COVID are unvaccinated.
Okay.
Those that are coming in, I'd say about 20% of the people that are coming that are vaccinated are not coming in for COVID. They're coming in because they've got another bacterial infection, they've got a urinary tract infection, they've got something else, or they're coming in for an operation, and because they're vaccinated, they're actually flying through the whole procedure.
Amazing. Are there still COVID wards?
There's no COVID ward anymore. We don't have COVID wards. In fact, certain wards are just sort of walling off one or two rooms so they can be treating the COVID patients.
I see that Netcare are no longer asking people to even have a COVID test prior to going in for a procedure.
So that's correct. That's going to be left to the discretion of the doctors who are treating the patients.
Okay.
To say if they've got no symptoms, they filled out their screening, they're not coughing, they've got no fever, and they're not coming in for, let's say, pneumonia, they're not going to ask them to test prior to coming into hospital.
That's a significant shift, isn't it?
Significant shift. There's a very big shift here. We're definitely tending and heading towards the endemic phase of this whole pandemic, and that's coming soon.
Okay.
Hopefully sooner than we think.
What about this new subvariant that we're hearing a lot about? I think 2 weeks ago you mentioned, was it 30% of the cases that you're seeing already are the subvariant? What does that mean now?
So the subvariant is known as the Omicron BA2, which is called the subvariant. In some places, the subvariant is said to be more virulent and it's easily much more transmissible and more severe. We're not seeing that. We're seeing a number of people being infected by it, even those who've been vaccinated but are staying at home, are not being admitted to hospital, are managing to stay at home, are managing not to have to go into any major dramatic medication like corticosteroids or things like that, but just actually staying home like a bad flu.
Right. What are the symptoms? What are the symptoms of Omicron or the subvariant? What are they compared, let's say, to prior waves of COVID?
So in the prior waves of COVID, the main symptoms were respiratory symptoms. People were coughing, people were getting pneumonia, whereas here we're seeing people with sniffles, people with sore throat, people with a fever. Those are the general presenting symptoms. And that's why, as we're going to be going into winter now, it's going to be very confusing when we go into a new wave, which we're expecting in April, May, to discern what we're actually dealing with.
If we have a new wave in April or May, does that mean it'll be a new variant?
So, as I've said before, it's very difficult to predict COVID. We don't know what's going to happen. Albeit, if it is a new variant and it's very similar to Omicron, we'll be okay with the vaccinated people.
Right.
As I've said many times before, this is not a disease now of vaccinated people. This is a disease of unvaccinated people.
So that's the question. People are saying, well, everyone's getting sick anyway. Isn't that the best immunity? Do the vaccines actually work?
So I think we've got to take it one step back and try and explain to people that when you've had COVID and you get sick from COVID, there's something called long COVID, which is the long-term effects of COVID. It's called PASC, post-acute sequelae of COVID, which is the consequences of COVID. The ramifications of long-term COVID are devastating. People are suffering from myocarditis, which is inflammation of the heart muscle, palpitations, depression, fatigue, neurological complications, severe coughs, pneumonias, long-term, needing long-term treatment, needing pulmonary rehabilitation, all other things. So it's not better to have COVID and get immunity, but that being said, if you've been vaccinated and you do get COVID, your immunity lasts for a lot longer.
Is it possible to have, because I suspect I might, asymptomatic long COVID?
So, as I've tried to explain to you before, being a presently well-versed hypochondriac, that you've got to actually wait about 6 to 8 weeks before you can call yourself a long COVID.
Right, but if I'm asymptomatic, I'm saying, do you think I could be asymptomatically suffering from
For
long COVID?
For a price, you can get whatever you want.
So it's like being at a shul. Okay, no different. Right, so the vaccine obviously is vital.
Vaccine is vital. The vaccine works. There's no doubt about it. You know, if you've been vaccinated, double vaccinated, you had a far better protection level than the general person on the street. And obviously, if you've had your booster, it's just dramatically improved. There's been studies coming out of the United Kingdom now showing the dramatic benefits of having a booster and having people triple vaccinated and how good it is.
Okay, so I was going to come to it, but let's just talk about that now. The booster shots, you are still advocating booster shots at this stage?
Right now, we're still advocating booster shots. I'm not convinced about a fourth shot, but I'm definitely convinced about a booster shot.
Okay. So that means if you've had 2 Pfizers, you'd have a third. If you've had the Johnson, you'll have
another Johnson.
Another Johnson, and
hopefully, if you've had a Johnson and a Pfizer, then somehow, someway, as soon as SAHPRA give the go-ahead, you need to have another Pfizer.
Okay. So that's important there. What I find a bit strange is I'm reading articles about them perfecting or working on a Omicron vaccine. What is the point? Surely by the time we get a vaccine for Omicron, either the wave will have passed or most of us would have had it. So
I think we've got to understand that this virus mutates.
Right.
And the more it mutates, the more it changes the envelope and the surrounding of the actual virus. Whether it looks at your spike proteins or your glycoproteins, all other different things. Every year, we get a flu vaccine, or we should get a flu vaccine, and it's very important to get a flu vaccine. That flu vaccine is taken from the Northern Hemisphere. When they go through their flu epidemics, we look at what their strains are and we model it according to that.
It's like buying from Zara on sale.
100%, except you're getting a massive sale. Okay,
right, exactly, fine.
One that fits. Okay. So you're taking this, and you're now going to take this sort of newly revolutionized Omicron vaccine, which won't only protect you against Omicron, it will protect you against different variants and a closer variant to a new variant that would develop.
Okay.
So it's basically gearing us up for an endemic type of COVID vaccine.
And do you foresee a time that we will be, every year, be getting both a flu vaccine as well as a COVID vaccine?
There's no doubt they're going to be combining a flu vaccine and a COVID vaccine in one, in the coming months.
Very nice. Okay, that will be very, very interesting.
You can get 2 for the price of 2.
Right, don't confuse me. Okay, COVID regulations, because this is very, very, it's not confusing in South Africa because we haven't really changed we have.
We have changed.
We've changed the quarantine. Yeah. Just tell us what the current regulations are in South Africa.
Okay, so the current regulations are as follows. if a hypochondriac like you gets asymptomatic COVID, okay? In other words, the only reason you're tested is because A, you're paranoid,
correct,
with no symptoms, or B, you were going for an operation where they were worried about the fact that you had COVID, or you're traveling, and then they realize you've got COVID. You don't have to quarantine. You don't have to isolate, but what you do have to do, and I think it's very important that people understand, you still have to wear a mask when you go out and are around people, and you still should isolate in the way that you socially distance from people. So you can sit like we're sitting now, more than 1.5 meters away, but you should be wearing a mask to protect the person who you are with. If you get COVID and you have got symptoms, you need to isolate for 7 days. You quarantine yourself and isolate for 7 days. Where it becomes confusing is if you've got people in the same house with you. And the law states that if those people are asymptomatic, they've got no symptoms, there's no fever, there's no cough, they don't have to isolate. So the best way to do it is if you have COVID and you're symptomatic, is keep yourself locked up in a room away from people. And if you have to go out of the room, make sure you wear a mask and see them outside, but try and avoid being with them. But those people need to have a social responsibility to say, hold on, the person in my house has COVID. There is a chance that I could be an asymptomatic carrier or spreader of this disease. Therefore, I need to take an upper level, make sure I wear masks and actually protect people around me.
Do people that have COVID and are asymptomatic have a lower viral load than somebody who has COVID and who has symptoms?
So we've definitely seen that people who are asymptomatic have a lower level of sort of transmitting the virus to people and a low level of actually getting sick from the virus because they've got a low level of virus load. And there's no doubt that if you are symptomatic, your viral load goes up quite dramatically, and that's why it's easier to spread the virus to other people.
Okay, I think that's a very important distinction as well. Around the world, COVID regulations are falling away, which is quite interesting because some places aren't asking for masks. Some places aren't. Israel's no longer demanding, I think, the green pass when you go into shopping malls. What are your thoughts around that?
So that's national evolution. That's natural what we're going to be seeing here in the coming weeks to months. It has to happen. This virus is going to become endemic. You know, when you look at a country like Israel, when you've got triple to quadruple vaccinated people, it makes sense. You know, they'll be coming out of winter, going into summer. It's going to be much easier to do this. And I think we're going to evolve in that direction soon enough as well, where the first step is to taking off masks outside, which we really need to actually be doing by now. I don't understand why the government are actually keeping us from taking off our masks outside, but nevertheless, that's the law. We've got to keep it on.
Is the law in public, or is that if you have people over?
Well, that's public. If you have people over and you're sitting outside I don't think that's considered public. That's private. You know,
so if you have people over, you're sitting in your garden, you keep a nice distance between you, that's private, and you're vaccinated. And we're vaccinated.
Then there's no reason why you can't sit socially distant and take off your mask. No reason at all.
100%. Okay. But inside, you still advocate masks.
Advocate wearing masks.
Okay.
Especially if you've got a non-well ventilated room, in a school classroom. You know, you've got to protect people at this point.
Right. In fact, on that subject of schools, we are seeing a lot of kids now with COVID. How are they handling it? What's been your observation around it?
So it's actually very easy to handle at the moment. Because they're wearing masks in the class, it's very easy to make sure that there's no spread of the COVID. If the kids weren't wearing masks and one or two of the kids were positive in the classes, they'd have to close the whole classroom down. But because they're wearing masks, they just have to take that kid out of the school and they're isolated or quarantined for 7 days and they can continue as normal.
And how sick are kids getting?
So they're getting very much like the flu-like illness, you know, sore throat, coughing, fevers. And the difference with kids is it lasts about 1 or 2 days and they're over it. Whereas with adults, it can last 5 to 7 days before they're feeling better.
That's the thing about kids, is they can kill you because they get sick, they get better in 1.5 days and they leave you in a heap. They do that.
Well, that's life. Kids leave you as you grow older.
Yeah, righty. And Unsigned says, can I submit this question? Can one test if they've had COVID? As I've been experiencing typical post-COVID symptoms, specifically joint pains, I have been double vaccinated, so won't that make my antibody test pointless?
So you've got to ask yourself, what's the advantage of testing if you've had COVID? What are you going to do different? There's really no real advantage to testing if you've had COVID and you're asymptomatic. What you can do is you can look at what you call your N antibodies, which shows if you've had acute COVID in the last few weeks. And then you look at your spike antibodies, your S antibodies, to see how high your levels are. At this point, we still don't know what a high level of antibodies means. So if your antibody level is 20,000 or 30,000, it may be because you're vaccinated or you're triple vaccinated, or maybe because you've had COVID but it doesn't show us exactly that you are acutely or you have had COVID acutely. So you've got to be very careful if you're looking to see for a shortcut to give yourself some leverage.
So why would anybody test for antibodies?
Well,
I
think it's more important for people who are immune suppressed.
Okay.
So let's say you've got multiple sclerosis and you've had 2 vaccines, and you want to check to see that, or even if you've had 3 vaccines and you want to check to see and you get COVID and you want to see what your antibody levels are. If your antibody levels are low, that would be a prime case to getting a monoclonal antibody to help you with your actual disease. Okay. We don't have them in this country at the moment, but they're doing that overseas, and there's a huge benefit to getting that type of treatment.
I saw as well that there's a new drug that SAHPRA have authorized here in South Africa for the treatment of COVID.
Yeah, so this drug came out in October last year. It came out with Paxlovid. This is the Merck drug called Molnupiravir. It's an antiviral drug. It's been
Can't they give it a name that we can remember?
Say it again. They will. Molnupiravir.
No one can remember that.
Just call it the big M.
Right, okay. Fine, I'll remember that.
So tell your doctor you need the big M.
Right.
Okay? It's an antiviral drug. It's shown to reduce the risk of COVID hospitalization or death dramatically, and it should be given within the first 5 days of your first symptoms, only to those over the age of 18.
Okay. So there's a very specific time and period that you can use this.
Yeah, 100%. And as I say, it's coming out as compassionate use, so it will be available soon. I'm not sure what the price is going to be, but I think it'll be well worth it to use it in your arsenal of treatment with regards to people who've been vaccinated and get sick, especially elderly people or people with comorbidities. And there's lots of new things that are happening at the moment. Pfizer have now applied to SAHPRA to get the go-ahead for vaccination for kids between the age of 5 to 11. So hopefully that will happen in the next few weeks. And then speaking about monoclonal antibodies, which we don't have here, there's a new one called Sotrovimab, which has been shown to help with people who've got Omicron. Some of the other monoclonal antibodies aren't helping, but this one is new.
Right.
And then, surprise, surprise, I know you're going to fall off your chair when I tell you this, another study just came out from Israel to show that ivermectin is ineffective in preventing severe disease or hospitalization, and there's a noticeably higher incidence of adverse effects for people who have taken ivermectin.
Wow.
Surprise, surprise.
Right, you're shocked by that.
I'm shocked.
I don't know why you didn't tell us in the first place.
And I should have thought of that from the beginning.
You really should have. Okay, a lot of people asking, and I'm happy that they're asking because it applies to me as well, is how long after you've had Omicron, assuming you've had your vaccines, are you safe?
So when we talk about safe, what are we talking about? Are we safe to go out in public? Are we safe to exercise? And they're all different things. So I think the most important thing is that we isolate for 7 days. After that 7-day period, if you are asymptomatic, if you're not coughing, if you don't have a fever, you're safe to go out, but still to wear your mask.
Okay.
When it comes to exercise, that's a very big thing. People don't realize the ramifications of exercising post-COVID and what it can do to your heart. We speak about this often, a disease called myocarditis, inflammation of the heart muscle. There's nothing worse than getting myocarditis. The palpitations, the chest pain, the fatigue, the inability to get up in the morning or to move around. It's a devastating disease. You have to be very careful when you want to start exercising, and the current guidelines say ideally you should wait between 1 to 2 weeks before you exercise, and it's worth waiting the 2-week period. Rather wait 2 weeks and then slowly but surely start increasing your heart rate. So the first few days, increase your heart rate to 30% of what it was. Then a few days later, go up to 50%, and then slowly but surely increase your heart rate to a comfortable level that your body feels comfortable and you feel comfortable. But I personally would recommend at least 2 weeks before you start getting back into an exercise regime, because you're going to do yourself deleterious damage.
Right. Look, I've been very careful. I've done this for 2 years just to not take any chances.
Yeah, exercise is very not your way to go.
I'm very, very cautious this way. In terms of Omicron and being almost like protected from, like, it's a strange thing, but there's quite a good feeling after you recover that you know you've just had it, you've recovered.
Okay, so let me stop you there.
You've got the antibodies.
Yeah, let me stop you there.
And it's actually quite dangerous, because I can see my own behavior becoming a lot less cautious because I've had Omicron. And it's quite a strange mental shift that I didn't think I didn't anticipate.
So you obviously didn't listen, but I said, let me stop you there.
Okay.
So part of me stopping is there saying, in December, I had a patient with Omicron. And now this last week had a patient again with COVID. So in other words, they got Omicron, they got the first variant, and now they've got the subvariant. So just because you've had Omicron doesn't mean you're protected against getting the subvariant and further variants. In other words, what it's teaching us is you don't have to be scared. You just got to be responsible. Yeah. Just keep on wearing your mask, keep on following the rules, and you'll be okay. But the point is you can get it again in a short time. We do know that the antibodies are there to protect us, and you won't get it as severely.
Right.
But just be careful.
But you can get it
Just
again.
be careful and be responsible.
So it's almost a false sense of security.
It's a very false sense of security.
Okay, that is interesting. Vitamin D, other vitamins.
So vitamin D, as we've spoken about before, is one of the big buzzwords. It's been going around for a long time. There's an up and down. Before COVID, we always used to say, you don't really need to take vitamins because whatever you take, you're going to basically urinate out if you don't need them, and there's no benefit if you have a good diet and you're eating well. What we've seen during this COVID period is that certain vitamins do help. Things like vitamin D, things like nicotinic acid, things like quercetin, all these type of different things do help and do make a difference. And it's not a bad idea to take a good multivitamin once a day that contains all of these vitamins in to help you, just to make sure that your levels of immunity are a bit higher.
So vitamin D, so something that contains vitamin D
100%.
Is always a good idea.
A good multivitamin with vitamin D, with niacin, nicotinic acid, with quercetin, with all of those type of things that can help protect you and just help make that immunity a little bit stronger.
Right. In terms of the other issue, of course, that we've spoken a lot about is mental health and COVID. We're at a very strange stage now where people are getting sick, but they're not getting terribly sick, but there is a lot of transmissibility, but we're all suffering from this cabin fever existence where we want to socialize, but we're scared to socialize. What's your advice around getting out there and mental health?
My advice is very clear. Get out there. Go out, start having fun, start enjoying yourself, do it responsibly, put a mask on and make sure you social distance, but get out there. It's summer, it's a beautiful day. There's lots to do in Joburg. There's lots to get around with. We've got to stop being scared of this now. We've got to take it head on. We're vaccinated. We've got to be responsible, but it's time to move forward.
Yeah, and we really do have to move forward.
100%.
Do you think that we really will see another wave, or are we going to move hopefully into the endemic phase?
So even if we're in the endemic phase, there's still a possibility of seeing another wave. It doesn't mean it'll be a pandemic.
I suppose like we get a new flu variant every year.
100%. And as then we don't even know what the flu variant will be when it comes to winter.
And we don't obsess about it. We just live with it.
We just treat it and we carry on as is.
Right. So the good news?
So there's great news. The numbers are even lower than last week. Although community numbers are up, overall we're doing extremely well with minimal hospitalization. And then let's spice it up a little bit and talk about something I would never speak about.
Soccer.
What a week for the Reds, for Liverpool. Winning against Inter Milan, Norwich, 2 awesome victories. And of course, last night, our thanks to the Yids for beating Man City. And to quote, families are like branches on a tree. We grow in different directions, yet our roots remain as one.
Absolutely awesome. On this note, on that note as well, I want to wish Dr. Meyberg and his entire family, including his daughter Gabi Meyberg, a big mazel tov on her bat mitzvah. She has just turned 12, so for our non-Jewish listeners, what that means is that she has officially reached the age of womanhood and becomes part of the nation as a woman. She's now obligated to take on all of the responsibilities and everything that comes with it. So wishing the whole Meyberg family a big mazal tov and lots of success for Gabi as she celebrates her bat mitzvah. I'm Howard Feldman. This has been the Sunday Synthesis podcast coming to you live from the Golden Acres and Sandringham Gardens. Wishing you a fantastic week. Don't forget to subscribe below. Keep sending us your questions and we'll see you again in 2 weeks. Have a great 2 weeks and God bless.